Okay, today we'll be talking about laser. So what is laser? Laser stands for light amplification by stimulated emission of radiation. And it's a form of phototherapy. And the phototherapy is a physical modality using photons of light from visible red and the infrared spectrum for tissue healing and pain reduction. There's 5 different technologies. There's the low-level technology, the non-coherent narrow bond light diodes, non-coherent broad bond light diodes, polarized light, and photodynamic therapy. So what are some properties of light? Obvious color, the polychromatic electromagnetic radiation of multiple wavelengths, and the monochromatic electromagnetic radiation of a single wavelength. Coherence is the property of identical phase and time relationship. Culmination is the make parallel. Tissue interaction, various effects on tissue. Therapeutic wavelength is between 60 and 1300 nanometers. And there's absorption spectrum. So basically, what is a laser? A laser light with wavelengths between 600 and 13 nanometers optimizes the depth of penetration, so at 1 to 4 millimeters. So you're really getting down 1 to 4 millimeters. 99% of light with the wavelengths of 300 to 1000 nanometers are absorbed into 3.6 millimeters of tissue, mostly skin. So the deeper physiological effects are thought to occur because the energy may promote chemical reactions that mediate processes distance to the site. So obviously with the laser light we're not really getting a lot of penetration other than through the superficial skin. But the thought is that the deeper effects, like in the tendons, are done because of a chemical cascade and chemical reactions that are occurred due to the light from the laser. So there's typically 2 types of lasers when we're talking about the medical field. There's the hot kind, which are used in surgery, and the kind that we use most often is the cold. Cold laser stimulates or inhibits biochemical, physiological, or proliferative activities by altering intercellular communication. So we know that cells kind of will talk to each other with electromagnetic forces. So what the thought is that the cold laser can help stimulate the different types of electromagnetic force fields in the body, and that communicates with other cells and promotes healing. Cellular effects of the laser: short-term activation of electron transport chains, so it increases ATP synthesis, decreases cellular pH, which creates an environment that increases macrophage, fibroblast, and lymphocytic activities. So it really makes an optimal environment for healing. Some physiological effects of laser are nerve conduction. So there's conflicting stories. Some people say it helps with nerve conduction. Some people say it doesn't. There's just conflicting studies. There's not a lot known. It increases vasodilation, so it increases the oxygen intake, increases waste reduction, and increases healing. And wound healing increases the leukocyte phagocytosis, fibroblast proliferation, increases collagen synthesis, increased circulation, and decreased bacterial growth. So anything good with healing. And it says to be a good with arthritis and pain management. Again, there's a lot of conflicting studies. So what are some contraindications? Direct irradiation of eyes. So 50% of the laser is reflected. So that's why when we're doing it, we'll take people into a isolated room where both people wear glasses. You don't want to do it within 4 to 6 months after radiotherapy. You don't want to do it locally to endocrine glands, to a hemorrhaging area, any area with a carcinoma, anybody with a fever, or in the vicinity of a pacemaker. These are FDA approved indications. It temporarily temporarily increases local blood circulation, the temporary relief of muscle joint and joint aches and pain stiffness, relaxation of muscles, muscle spasms, and minor pain and stiffness associated with arthritis. Some precautions: epilepsy, fever, malignancy to the low back or abdomen during pregnancy or menstruation, to the embryo or fetus over gonads, epiphyseal lines in children, in confused or disoriented patients, areas of decreased sensation, infected tissue or cardiac regions in patients with heart disease. There's a couple of techniques when you're actually doing the laser. The first one is Potten's principle, and these are basically the trigger points. You palpate the area for tenderness, and you want to treat the most painful and tender areas, and reassess and retreat as needed. And then when you're treating for edema, this is the Oshiro principle. Basically what that says is you treat the proximal site for drainage first. This opens up the pathway for lymph drainage. And then you treat the distal areas next, and then the injured areas. So let's say you're doing an ankle. What you would do is you would do a couple minutes of the laser treatment maybe on the groin, and then a couple minutes on the back of the knee, and then you would actually treat the ankle. And what the idea is that you're opening up the lymph system so you get proper drainage.